Hi everyone and welcome to my YouTube video. Today we'll be learning about the anatomy of the shoulder joint. So let us go into our video. The shoulder joint is also called the glenohumeral joint because it is a joint that connects the head of the humerus and the glenoid fossa of the scapula. So the shoulder joint or glenohumeral joint connects the upper arm to the chest. It provides articulation between the glenoid fossa of the scapula and the head of the humerus, as we have said. These articulating surfaces are separated by a narrow cavity filled with synovial fluid, making it a synovial joint. So, our shoulder joint is a synovial joint because it is encapsulated by a joint cavity, and inside the joint cavity there is synovial fluid, making it a synovial joint. The joint is an example of a ball and socket joint, which is highly mobile due to the minimal contact between its two articulating points, allowing for a wide range of movement. This extra mobility does, however, come at an expense of joint mobility. So, as you know, we can move our shoulder joint as much as we can and as much as we want. It is due to the synovial fluid, and it is one of the most flexible joints in the human body. And because of its stability and its mobility, most injuries, or it is at high risk of getting injured if it is not extended or moved correctly. So the shoulder joint is made up of ligaments, bones, and muscles. So this is the connecting network of the shoulder joint. The ligaments are the connective tissues that ensures the joint stability and flexibility. The bones, which are the skeletal framework, provide structure and support to the shoulder, and the muscles are the dynamic components enabling movement and stability. So we'll go into details of what kind of bones, ligaments, and muscles are at the shoulder joint. So let us start with the bones. The shoulder joint is made of the humerus, the scapula, and just a bit of the clavicle because the clavicle is joined with the scapula, and hence the head of the humerus is joined with the scapula on the glenoid fossa, making it a glenohumeral joint. So you've got the humerus, which is the long bone of the upper arm that fits into the glenoid cavity of the scapula. You've got the scapula, which is the flat bone that forms the back of the shoulder and has the glenoid cavity. And we've got the clavicle, which is the collarbone that connects the arm of the body and helps stabilize the shoulder. So the muscles at the shoulder joint. These are the muscles that are at the shoulder joints. We have the rotator cuff muscles, which is a group of four muscles, which is the supraspinatus, the infraspinatus, the teres minor, and the subscapularis, which help in stabilization and allows rotation of the shoulder. We've also got the deltoid muscle, which is the muscle that covers the shoulder and is responsible for lifting the arm. And we've also got the pectoralis major, which is the muscle on the chest that aids in the arm movement and stabilization. So the ligaments, we've got the acromioclavicular, which is the joint between the acromion and the clavicle, and we've got the sternoclavicular, which is the joint between the sternum and the clavicular joint and the clavicular bone, and we've also got the coracoacromial, which is the joint between the coracoid and the acromion. And we've also got the coracoclavicular, which is the joint between the coracoid and clavicular. We've got the joint capsule, since it is a synovial joint, any synovial joint has a joint capsule. And the last joint is the coracohumeral, which is the joint between the coracoid and the humerus. This makes the ligaments of the shoulder joint. So movement at the shoulder joint, we've got your extension, we've got your flexion, which is flexion is bending the whole joint. So it's bending your whole arm or bringing your arm forward. And when moving it backwards, that is your extension. Then we've got your abduction and adduction. Abduction is moving it away from your body, and adduction is bringing it back. We've got your internal and external rotation, which is happens when the rotation, which is rotation towards the body, that is internal, and away from the body, it's external. Then common shoulder joint injuries could include dislocation, impingement syndrome, shoulder arthritis, or rotator cuff tear, which is tear in the four muscles that we mentioned in the rotator cuff, or is shoulder joint, frozen shoulder joint, which is when your shoulder joint is unable to move, and we've also got fracture. This is all for our video today. These are the references.